Hi friends, welcome to the Stories with Shivaram channel. Today's story is about how heart diseases are being treated using nanobirds, a revolution in the field. Heart diseases continue to be the leading cause of death worldwide. The problem of plaque, which is caused by the accumulation of fatty substances and cholesterol in the arteries, troubles many people. Now there has been a remarkable development in the field of science. Scientists have developed something called nanobirds in a microscopic form. Research shows that these nanobirds can remove blockages in the arteries within minutes. This could potentially reduce the need for heart surgeries. So, what exactly are nanoparts? Let's find out now. Nanobirds or nanoparticles are extremely tiny particles that are invisible to the naked eye. They are millions of times smaller than a strand of a hair. Scientists specially design these tiny particles and send them into our bodies. These nanobirds travel through the bloodstream in the arteries and reach the exact spot where there is a problem. Researchers at the South Australian Health and Medical Research Institute have developed these special nanoparticles. The team working under the leadership of Dr. Victoria Namkiwel has given these nanobots two special abilities. The first is to identify the plaque in the arteries and remove it. How does plaque actually form in the arteries? Let's find out now. The tubes that carry blood from the heart to all parts of our body are called arteries. Healthy arteries are smooth and allow blood to flow easily, but due to certain reasons, cholesterol, fatty substances, and other waste materials start accumulating on the inner walls of these arteries. This is called plaque. This plaque gradually increases and narrows the arteries. When the arteries become narrow, the heart does not get enough blood and oxygen. Because of this, problems like chest pain and shortness of breath can occur. Sometimes this plaque can rupture and cause blood clots to form. This leads to a heart attack. Not only that, swelling also develops in the area where this plaque is present. This swelling further contributes to the formation of blockages. In this way, a vicious cycle continues. Let us now understand how nanobots work. These nanoparticles developed by SAHRMI scientists work in a very intelligent manner. Their functioning happens in three stages. The first stage is identification. After the nanobots are sent into the bloodstream, they travel through the artery searching for the locations where blockages are present. These nanoparticles penetrate the artery walls and enter the immune cells present there. Now, the second stage is treatment. After these nanobots enter the immune cells, they perform two main tasks. First, they reduce the inflammation present in that area. Then, they identify the harmful cholesterol in the blockage and remove it. The third stage is elimination. The nanobots carry the harmful cholesterol all the way to the liver. The liver acts like a purification factory in our body. There, this cholesterol is processed and expelled from the body. Now, the research results are promising. Dr. Nakevi tested these nanobots on heart disease models in the laboratory. The results were very promising. Some key observations were made during the tests. The size of the blockages decreases significantly. The swelling also reduced a lot in the tissue. The nanobots precisely reached the problem area. They did not cause any harm to the healthy tissue. Not only that, the entire process happened very quickly, just within a few minutes. Now, the most interesting thing about these nanobots is how they can hit two targets with a single arrow. They can do two things at once. Along with their ability to cheat, they can also function as diagnostic tools. The next point is about their diagnostic capability. With advanced imaging technology, doctors can track where these nanoparticles are moving inside the body. They tend to accumulate at the site of inflamed plaque, so doctors can detect the problem early on. At the same time, these nanobots begin to reduce the plaque. This way, both diagnosis and treatment happen simultaneously. This dual capability is extremely valuable. Doctors can identify at-risk patients early and start treatment before a heart attack or other serious problems occur. Now the next question is, how does this work better than current treatments? Currently, there are various methods for treating heart diseases. The main one is medication. Medicines to reduce cholesterol, blood pressure, and so on. These can reduce the risk, but they cannot completely remove the block that has already formed. The second method is angioplasty. In this, a small balloon is inserted into the artery and the narrowed area is widened. Sometimes a small tube called a stent is also placed. While this is effective, there are risks involved, and sometimes the problem can recur. Next comes bypass surgery. This is a major surgical procedure where another blood vessel is used to bypass the blocked part of the artery. Since this is a major surgery, the risks are higher and the recovery time is also much longer. Nanobirth treatment is much better than all these methods. Since this is not a surgical procedure, the risk is very low. It addresses the root cause of the problem. It helps in early diagnosis of swelling and cholesterol buildup. It works very quickly. It reaches the specific target. It does not harm healthy minerals. This is the direction of the invisible future. Laboratory tests. Since they have been successful, the SAMRI team is now developing this technology suitably for use in humans. This happens in several stages. The slab safety tests. First, it must be confirmed whether this nanobot is safe for humans or not. Even though the laboratory results are promising, it should be ensured that there are no adverse effects in the human body. The second step is clinical trials. After that, carefully monitored tests are conducted on patients. This starts with a small group and gradually expands to larger groups. Next comes the efficacy study. They study how well this treatment works in humans and how it is better than the current treatments. The next step is regulatory approval. After completing the necessary tests, approval must be obtained from the government health authority. The scientists' goal is to make this technology available as an adjunct to existing treatments. This can be used along with current treatments, not as a replacement. That way, better results can be achieved. What should we do for heart health? While this new technology is promising, prevention is always better than cure. To maintain better heart health, we should follow certain things in our daily life. First is a healthy diet, eating more fruits, vegetables, soups, and especially millets. Reduce fat, sugar, and salt intake, and eat fewer oily and fried foods. Next, make sure to exercise regularly. Walk or do any physical activity for at least 30 minutes a day, 5 days a week. After that, control your weight and maintain a healthy body weight. Excess weight puts additional strain on the heart. Next, quit smoking. Smoking is a major cause of heart disease. No matter how late you quit, it is always beneficial. The next point is stress management. Practicing yoga, meditation, deep breathing exercises, and getting enough sleep. Through these, we can reduce stress to a good extent. Next, regular checkups are important. You should routinely check your blood pressure, BP, cholesterol, and blood sugar levels. Coming to the conclusion, the treatment of heart diseases through nanobots is a great advancement in medical science. The efforts of SAHMR scientists in this field bring new hope to lakhs of heart disease patients. This technology has the potential to reduce the need for risky surgeries. While clinical trials are still awaited, the laboratory results so far are very encouraging. In the coming years, this nanobars treatment could become a part of standard medical practice. At that point, it will provide heart disease patients with a safer, faster, and more effective treatment option. As science and technology advance, medical solutions that once seemed impossible are becoming a reality. Nanoband technology is a good example of that. It shows how heart care could change in the future. This is from Hero Story. For more such interesting stories, keep watching our channel. Thank you so much.